I'm gonna be late for class. Oh, 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 oh.
Ethan, are you okay? Are you okay?
Oh, my testicles hurt. Oh, I think I'm gonna throw up.
Do you need a garbage?
Please.
All right, I'm getting one right now. That right there could be testicular torsion. To further explore what our friend Ethan just endured, we're going to talk about what needs to happen when a person is going through testicular torsion. To start, we saw that Ethan was on the ground asking for a garbage pail. This could possibly have happened because an individual experiencing testicular torsion will be sweaty, they're going to be nauseous, they're going to vomit, and they're going to be dizzy as well. These are all common symptoms of getting hit in the testicle in general, so it makes sense why this would happen during testicular torsion. Ethan, in this situation, needed to be rushed to the hospital as fast as possible and needs to be treated within 6 hours. Don't even think about trying to sleep it off if you're feeling pain in your testicles. The surgery being done is called orchiopexy, which is the untwisting of the spermatic cord and the suturing of the testes against the scrotal wall. Anything over 6 hours could lead to severe damage of the testicle and possible removal.
Oh, if only someone knew what to do.
I know what you have.
But let me explain it first. So here we have your testicles. Contains spermatic cord, your epididymis, and your testes. So normally, your testes rest like that at a diagonal angle. Nothing happens. We move over here. This is Bell-Clapper syndrome. This is when your testes go horizontal. So your spermatic cord and epididymis are also horizontal. This can lead to another problem known as testicular torsion. So right here, I'm going to draw your spermatic cord. Normal from the start. As you start coming down, it starts twisting a lot. What problems do we think that could cause? What does the epididymis and the spermatic cord work together and bring to the testes? Blood. Since there's no blood flow entering the testes, there will be a lot of inflammation and swelling, which can lead to severe and immediate pain.
Let's dive a little deeper into the causes of testicular torsion. To start, testicular torsion is a very common anatomical deformity that is found in 1 in 5,000 males under the age of 25. This means that you could be at risk. This could be caused by quick movements and direct contact seen in a lot of athletes playing sports. As mentioned earlier, Bell-Clapper syndrome is when the testicle is not properly anchored, which is also a direct cause of testicular torsion. It is most frequent, as I kind of said earlier, in adolescent adults from 12 to 18 who are probably the most active because their testicles are getting heavier and larger while the spermatic cord is still not fully developed and it's hard for it to support the heavier and larger testicle. Lastly, the cremaster muscle plays a role in testicular torsion. At the age of 12 to 18, your cremaster reflex is at its fastest. So the culmination of your heavier and larger testicle with your weaker spermatic cord and the fast movements are what cause testicular torsion.
Ethan, what happened?
They told me my testicles twisted.
Are you gonna be okay?
Well, luckily I got here within a couple hours, so they were able to save my testicle before the blood flow got cut off for too long.
How did that happen?
So I found out that I have Bell-Clapper syndrome. So basically, my testicle is not properly positioned and attached within the scrotal wall of my scrotum. So they described Bell-Clapper syndrome to me as if it was a bell and the loose clapper inside, and it's able to freely move around without being properly attached.
Whoa. How do they fix that?
So they're able to perform orchiopexy, where they're able to put my testicle in the proper position and untwist my spermatic cord.
And what if it happens again?
Well, luckily, when you do orchiopexy, they suture the testes against the scrotal wall to prevent this from happening in the future.
I'm glad you're gonna be okay, Ethan.
I really appreciate your support.
And it goes